Welcome to Middle Fingers Up, the show where we hold our heads high and our middle fingers higher. I'm your host, Kieran McKay. Okay, so today's another It's Good to Gup Shup episode, segment, however we want to call it. So we're here, Middle Fingers Up, having our little It's Good to Gup Shup talk. This is where we get into specifics, yet meaningful conversation, share stories, create space for learning and all that hard unlearning. Today's conversation we're so thrilled about because we're welcoming back Dr. Hussain. If you've been following our podcast, you might remember her from episode 93. What does a normal period actually look like? In that episode, we had a discussion about menstrual health, education, and really, honestly, the importance of period literacy for all of us, whether we get the period or not. So now Dr. Hussain is back, and we're looking into a topic that's just, I feel is crucial. I saw this on Dr. Hussain's socials. She had posted about a recent learning conference that she went to, and it's about the intersection of weight stigma and medical care. And so Dr. Ann is here. As we know, she's a naturopathic doctor. She talks a lot about period literacy. She also is the author of the Period Literacy Handbook, and she's made it her mission to empower individuals with tools and knowledge to better understand their bodies while challenging societal norms and expectations around weight and health. So we're super excited to have her back. Dr. Ann, let's unmute you here. Welcome. How are you doing today? Thanks for being here.
Thanks so much for having me. I'm really excited to talk about this topic that I am also learning alongside you.
Yeah, I'm really, really happy we had a little chat beforehand to hear you talk very open about, listen, I'm learning too. And honestly, it's very, very inspiring when your leaders, such as your doctor that you're looking to, is like saying, hey, we're all on this learning curve together. But let me put a little bit more time and effort because you're coming to me to get this info. So thank you for that. Because I think we talk about weight stigma in all sorts of parts of our worlds. And sometimes we don't really get to the bottom of like, where does it come from? So how about before we do it though, we do a little like congratulations to you because I keep an eye on you. I follow you. I love the work you do. You're getting so like, I want to say goofy out there with your posts. And I love the lightness that you bring to such hard topics for a lot of people dealing with menopause, people dealing with their periods, people dealing with not having their periods, fertility, all that stuff, PCOS. And I mentioned menopause. So a huge congratulations to you because you also recently completed a certification, which allows you to help more patients in the realm of perimenopause and all that jam. Yeah.
Yes, thank you. Yeah, the Menopause Society is a North American organization, especially working toward improving the standards of care for menopause and perimenopause and life post-menopause, because a significant chunk of our time is spent after menopause, right? So I've been supporting my perimenopausal and postmenopausal patients for a long time now, but this certification was really lovely because it was like the most up-to-date research and the medical guidelines and what we know and where the gaps are as well. So I'm really excited to have done that and feel a lot more confident in my own knowledge and looking forward to learning more.
Oh, I appreciate that. So congrats. And then one more. I noticed one more thing. You just recently received an award for being the best in the area of Newmarket. Is that not true? You're laughing at that. That's huge.
No, it's true. Thank you very much. I know.
What's so funny? It's true, right?
It's funny because it's very sweet. I feel very I'm not very good at receiving compliments.
I hear you. No.
Yeah. But I really appreciate it. Yeah, that's a community award. So I was very humbled and honored to A, have been nominated and then B, have won the Platinum Award.
Oh, that's huge. Yeah, like the nomination in itself is the win, that someone recognized the work you're doing, how you're doing it, and then to get the win, that's just the icing on the cake. So congrats. We're all paying attention. Let us know for those that are listening or watching, because now people can do that too. Where can we find you to continue to keep an eye on you? Where's the best place?
Yeah, I'm on LinkedIn, although that's like more, professional stuff. I'm most active on Instagram, I would say. Like that's I don't really want to learn other social media platforms.
Yeah.
So that's where I hang out because I know
we must be from the same age era.
Probably. So that's really where I am. There's also my website, which is more of a static, representation of the work that I do.
Yeah. And I want to say from episode 93, we had people reach out and ask where they could get your book from. And somebody was suggesting we should be calling our local libraries and getting them there, because a lot of young people don't have access to this, and as well as purchasing them. And so I just love the conversation that generated. And so I think especially having BIPOC authors out there, right? And filling up our library shelves. So I just want to say, like, huge impact that book is making on lots of people and on our end as well. So, kudos to you and everything you're doing. So, yeah.
Thanks so much. Yeah, it's available on most online retailers, as well as some local stores that I've approached. Basically, like that's kind of how it works for a lot of books. But yeah, if you are near a library, you can request it, and they can stock it.
It'd be a cool stocking stuffer as the holidays are approaching as well. So
definitely, I've had a lot of people be like, okay, I'm going to buy it as a stocking stuffer for my kid or for my friend or for my colleague, and it's really, really lovely to hear that. And I'm currently working on recording the audiobook, so that'll be out early next year.
Oh, that's awesome! That's great. I love that. I'm going to make my whole family listen to that on a road trip. The mom's got a book for us. I can't wait for that one. Mega eye rolling in the back. But they'll do it. Who cares if they eye roll once or twice, right? They'll still do it. So I appreciate that part. Okay, so this is why we don't end up being 10 to 12 minutes, because I like to spend so much time welcoming you and chatting with you. But I also thought these were important highlights. So congrats. And if we just get back to the topic, so we're talking about weight, stigma, and medical care. So maybe we can set the stage, some context. As I was saying to you earlier, I was doing a little bit of my own prep, and just why did we want to talk about this? And what really caught my eye was a post you had made about attending a conference and some tools you learned. And that just, the whole weight stigma, those two words together really stuck with me for lots of reasons. And so I started digging, doing my own little thinking, okay, what do we want to talk about? What's this about? And just, if I could add a little bit of my own context, and please, you're welcome to add yours. But, we are really glad that this is happening today, because this conversation is so important in the way that weight is perceived and stigmatized, right? That's what we're talking about. And not just in our homes, but in the medical professions particularly, because those are the ones that are very influential. We're supposed to guide life by our health. And so it's always interesting when our health starts with lose some weight. And this one's for anyone and everyone that's been told just eat less and lose some weight. And so when we're told these things, there's lasting impacts on our physical health, our mental health, because we're missing the big picture, the whole history, the context of how did I get to this place and why am I seeking health needs, whether it's to lose weight or I'm here for other reasons and being told I need to lose weight. But when you look back at why we got to where we got to, things that stand out for me that I want to sort of point out is, we talk a lot about colonization and settler mentality out here on this podcast, because a lot of our history starts there, and yet we don't start there as a society. And so when we come from settler colonization, we come from eating off the land, we come from lots of the agriculture era, so farming and whatnot. And then over time, those ethnicities that were impacted in particular by colonization have not had time to heal. And in this time, we get into the Industrial Revolution. And so during the industrialization era, we start to see a lot of, and the best way that I can do this, because I'm not a history class professor, is if you just imagine a conveyor belt. That was a time where everything was one size fits all, standardized, and healthcare started to sort of follow that as well. So medical care started to be about Western stats, lots of one size fits all. So, you get into the late 1970s, and then you have this sociologist that wants to do social experiments, as sociologists do, and decided to track weight and height to do some trends out in the community. And this is how BMI, body mass index, sort of came to. But yet the medical profession adapted it and started using it. And so I think this one stands out a lot for me because a lot of us know about BMI, whether we work out or not. A lot of our doctors track this. They teach us to track this. We look at a lot of our cardiovascular health. We look at all these sorts of things. And then I'm sorry if everyone else knows this and I'm the only one to find out. Like I said, I'm always late to a party. I just learned that, like, also when you think about BMI, it's so individual. And I never thought of it that way when personal trainers would use it, or I would use this with my physical health, my annual. It's about my own individual health. It's my height and my weight. But we've been using that together. We've been saying everyone that's this height and weight, everyone that again, that standardized conveyor belt sort of mentality. And many of us have been using things like BMI as our primary source of health solutions. And we're missing the holistic picture, the history, where do we come from, our ethnicities, all these sorts of things that now people kind of laugh at and think, well, that's a waste of time. Why are we talking about those things? All of these things that I'm saying, for me, really stand out because they really play a part in how I view my own weight, my body, my own health. And I know I'm not the only one. So I just think, we have all these sorts of things that are getting in the way of us being healthy, looking at the things that we need to. And so I'm curious now, as we try to unlearn all this, because we've been, taught this for centuries and for decades and for years. How do we go ahead and unlearn all this, right? So this is why we have a Dr. Hussain here to just sort of like start this conversation with us, figure out what can we all do individually. This is not going to be something that, you go to a conference and they say, oh, as of next week, we're all going to be back to this. This is individual, collective, lots of work together. So, before moving forward, because I've mentioned weight stigma a few times and we can kind of tackle what that means. Dr. Hussain, anything you want to add or anything stand out for you with context in terms of how we got to this place of weight stigma?
Yeah, you brought up a lot of good points. And as we prefaced our conversation, neither of us is an expert in this field. We're both learning as we go. And I'm not very good with like timelines in terms of history either. I'm not no history professor.
Yeah.
But the BMI was really created as a population level metric, derived from white European males, right? And then we've extrapolated that to the individual level, which, as you mentioned, is an imperfect way to use it. And there's so much more that goes into health. And we've started equating thinness and health together, which is inherently problematic. And as I say that, I'd like to also acknowledge, right, like we are not, like I am not a fat person. And even the word fat when we use it. So if we take a look at fat advocates, they prefer the term fat, a lot of them. In my office, I'm actually mimicking or mirroring the language that my patient is using and asking questions about their relationship with their body, because I see a lot of PCOS in my practice. And the conference that you had been mentioning about, I was speaking about PCOS, and I was sort of highlighting how PCOS patients specifically, because weight loss is one of the tools that is used to facilitate better outcomes in their menstrual cycles, fertility, and decrease their risk of cardiovascular disease. And a tiny reduction, like a 5 to 10% of weight reduction, can help improve those parameters. But PCOS patients come in all sizes and shapes. They look like a lot of different things, right? But and sometimes patients have been working on their care, but they have a medical experience where they're still just told to eat less, move more. There's nothing more we can do for you at this point in time. Or come back when you want to get pregnant, right? Like this medical advice, I'll put it in quotes because it's not really medical advice. It's part of this weight stigma that we see in the medical system. And at the end of the day, doctors are humans too. They've been exposed to the same messaging that we've all been exposed to from a young age, whether that's in the media, whether that's in their homes. And same with my PCOS patients. Oftentimes, if they do carry a lot of fat, then they have been exposed to a lot of that talk and in their homes from a very young age. And then they live in a world that systematically and structurally doesn't really make space for them, right? Like if we take a look at seats or if we take a look at weight limits on chairs, right? Like there's all of these different things that we can talk about in that. And part of my journey of exploring this, it has been partially through the lens of my patients, hearing their stories and trying to understand better where my biases are coming in, because I've been exposed to this as well, right? Like I've had cousins who dieted from a young age. I have had a mother who has been criticizing her body for an old age. In South Asian culture and in a lot of cultures, it's very common that the first words out of someone's mouth, if they haven't seen you in a long time, hey, you've gained weight, you've lost weight, you look great, you look this, you look that, right? It's so common. And even within that, there's a double standard where it hits heavier for women than it does for men.
Yeah, you look good versus you don't look good. There's a huge difference in the times that we say that with weight gain, weight loss. So yeah, absolutely. I'm just everything that you're saying. I'm like, yep. Like you're. I think you're hitting a lot of homes that are tuning in today, because we don't even realize the script that we're following when that's all we've ever known. Like, how do you know there's anything different? And that's part of why we're here today, is to talk about these things, to help us sort of look at things from a different perspective, even if it's one tiny little way of looking at something that maybe as a collective, we can all put together to shift the way the medical world, and I want to say, like, I was at a conference a couple weeks ago, a longevity one. And what I appreciated with a lot of doctors that got up was changing the databases that are being used to collect our information, training professionals to ask questions in the same way that naturopaths have always done when we go there and get the full assessment. And sometimes we're like, why are you asking us 7,000 questions about all this stuff? Like my mother's 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 mother. I don't know. But at this conference, they're like, okay, we are starting to ask more than just height, weight, like, are there addictions? Are there, if you think of the adverse childhood experiences, the ACEs, that's it. This came out eons and eons ago, and we use it a lot in mental health for trauma. But that right there was an indicator of why, if you want to, quote unquote, call someone obese, why someone would be fitting under that category. There was like a list of traumatic life experiences that have led to people's poor health. And yet we know this info, and we still are, showing up in practices because of the quick in and out fix. So I don't know if you want to add anything to that, but
I do actually. So you brought up adverse childhood experiences, and then to that we'll also add in the social determinants of health, right? Like if we take about how someone looks, it's about their genetics, it's about their epigenetics, it's about their family of origin and their upbringing and their nutrition and their exercise, yes, but also like resource availability. How many, like, do their 24 hours in the day look like Beyonce's 24 hours in the day? You know what I mean? Like, and we can all argue that they're different a little bit, not to jab on Beyonce.
yeah, like, you do you, Beyonce, but no, most of us don't have a day like that.
But you know what I mean? Like what we have access to is different, and how we even like perceive ourselves. And again, like I work with a primarily PCOS type of population, and these patients also have other challenges in how they look at themselves. There's a higher amount of body image distress, you know what I mean? Like, and adverse medical experiences. So like it's not one thing, it's all of the things. Just like PCOS, it's a multifaceted condition. How we look also is very, very multifactorial and not just one thing. And the unfortunate thing in our social media world of like quick comments is that, oh, if this person, right, like everyone is passing judgment on everyone else, and it creates such a hostile environment. So it's such a weird and interesting thing to think about. But at the end of the day, is bringing it back to medical care. We also know that if we show medical professionals during their training and education short videos, like we're talking about like 15 to 20-minute videos on certain biases they hold, including weight stigma, we start to have better outcomes, and their understanding and the way they interact with patients significantly, right? Like 17-minute video. I think that's like very implementable. And also the other thing I was going to say is like right now we're also in a very weird spot when it comes to like the body neutrality and body acceptance movement because of Ozempic, right? Like I think we're in a very weird space, and I don't know, like I'm not calling it like a bad space or a good space. It's just like a weird, interesting place to be in, because even the leaders in the body positivity, body acceptance movement, some of them are using Ozempic, and again, like there's a lot of feelings that are coming up from the community, like the global community, right? Like from different pockets. So it's I always like thinking about it, no conclusions, right? Like, but a lot of reflection. And I think we can learn from a lot of fat activists even. And there's some books that we remind me to mention them before we hop off, because I think we can all use a little bit of guidance as to how we unpack this for ourselves, because the norm has been to sort of correlate fat with negativity. Where at, right? Like even like I'm feeling, quote unquote, I'm feeling fat. Right, like that's a negative connotation.
It literally is like a descriptive word. Yes, right.
Yeah, we don't want to look like these people, right? Like that's kind of what we're saying. And I think like because like that's been the norm, it takes a lot of conscious effort and conversations like this, which aren't necessarily comfortable, right? Like my heart is racing right now as I speak about this. But
why?
Like,
what's a big reason? Tell us.
Because it's uncomfortable, right? Like because like I'm as we're talking about it, I'm like reflecting at the same time about my own experiences, I used to be underweight, and then still in a thin body currently. However, just like that transition and everyone commenting on it, difficult, right? Like lots of feelings.
And like, let's be clear, thin body is a flat stomach. Like that, at the end of the day, if you have bigger quote unquote arms or a big butt, or you have big boobs, or you're, I don't know, got a double chin, whatever, we are all the parts of our body that are fat, that we call fat. And I'm saying this based on the way we've been taught in society. I'm not saying I agree with this, but this is how we look at it. But if your stomach is flat, then you can kind of get away with all that. And it's a weird way in where we even say, okay, one hand we're saying be thin, but then on the other hand, the way clothes are designed, they're designed for you to fit in a way of you can have a big waist or big what, but if you have a big belly, it's just very interesting. Like even when we're specific about if you're going to gain it, where you can gain it, and again, we're not looking at it from a health perspective, like you said, it's from the eye, the aesthetic. So sorry, I just totally. That popped in for me too as well, because as you're having so many moments going through your head, total, like lots of guilt, lots of feelings of all the diets and but then also at the same time of like, you think about surgeries, that's Ozempic and surgeries to me can, there's like you either are for or not in a similar way as well. We have access to pay to lay somewhere and go under in a risky way to cut out a bunch of fat to look a certain way, right? Like like there's so many of these ways that we have access to that. So then it does start to become of like, why wouldn't we? Why wouldn't I want to look like that? Why wouldn't I want to do that?
Yeah, and that sort of brings us to even like going back to that, like thin versus fat, like these are subjective terms in a lot of ways, right?
Yes.
Like some of it is derived from like the BMI, and that's because we've learned it, like that's like in my brain, and that's also how we categorize people when we're doing research studies, for example. And when we see like the highest magnitude of improvement, for example, when someone has weight loss and PCOS, for example, and I prefaced my talk with this when I was teaching clinicians, I'm like, I'm going to talk about the BMI because that's what the research is on. And I don't know how not to talk about it in this context. I'm hoping that there will be better ways. Right. Like, and it's a hard thing to say, but at the same time, it's what we have to work with at this point in time. Right. And the thing also is that ultimately, even if someone doesn't lose weight, health promoting habits will improve your health. And that's what we see in PCOS, and that's what we see in the general population as well. If we focus on, let's say, increasing fiber in the diet, if we work on, moving our body in whatever way to begin with, but obviously we do want to hit some targets in terms of formal exercise because that's associated with better health outcomes. But sometimes when people are going into the doctor's office and with a certain complaint that is not weight related, sometimes people with weight to lose are being told with weight to lose. I use that very loosely and in quotation marks, right? Like from that practitioner's perspective, then the advice is like, do this first, right? Like that's like the primary thing without knowing anything about the history. Like I have PCOS patients go into endocrinologists and they don't even screen or ask about a history of disordered eating or eating disorders, which is such a disservice because that has a super high prevalence in that population.
And I just want to add, our episode 2 for our fertility, one of our guests later came back for Stephanie for another episode about, not undiagnosed, but symptoms of eating disorders we talked about. And she went into the hospital so many times because of her eating disorder symptoms, but because she was a bigger girl, again, quote unquote, one would not guess that she may have eating disorder symptoms because she lost significant amount of weight that was unhealthy for her, but she didn't look like what we are shown on TV, skin, bones sort of thing. So then again, we're as health professionals, as family, we're all looking for something that is this one thing, not all these other ways of getting there. So I'm not surprised that you even bring that up because you're right. Like there's such a link there. But we're in such a fast-paced medical world. We're not stopping and looking at all these patterns repeat.
Totally. And you hit the nail on the head. Eating disorders come in all body shapes and sizes, right? Like healthy blood pressure also comes in all shapes and sizes. You know what I mean? Like it goes both ways, right? Like good health and bad health, however we're defining it, comes in all shapes and sizes. And that's where the checking of our biases really comes in. Let's not assume, let's ask questions and do the proper assessment, right? Like let's screen for the things that are common in certain age populations or certain, backgrounds, whatever we're looking at, or if someone has a diagnosed medical condition or has been on a certain medication, let's not make assumptions based on what someone looks like because we can't judge a book by its cover.
Right. So as we've been talking about context, we've kind of jumped into already understanding what is weight stigma. But if we haven't made it clear, what is in the simplest way, how would you define it?
I would define it, it's a good question. I would define it as assumptions based on how someone is presenting in front of you, usually related to the amount of fat on their body.
Okay. And so when we're understanding what is weight stigma, and as you've been talking about this with your context and some examples, can you give an example of a patient, medical professional sort of back and forth? Like how could this stigma sort of come up in a doctor's office? If I show up tomorrow to talk about whatever, what am I looking for? What am I paying attention for so that I can work on my own bias and maybe my doctor will too?
Okay, I'll give you sort of a combined sort of picture from things that patients say to me in my office. So it could look like you going in for, you have PCOS. I'm going to stick with that because that's my primary patient population. Let's say you have PCOS and you're in your 20s, you go to an endocrinologist who, for an appointment that you've been waiting for like 6 months because getting a referral is difficult in Canada right now. And then
that's another episode we'll get to.
And then you go in and then the doctor looks at you, looks at your chart and tells you you're lazy and you're fat and you need to eat less and move more. And your PCOS is going to automatically start to get better. no questions asked about like if the person has been doing anything or if they have made any changes, if they actually have even lost weight or something like that, or if their menstrual cycles are regular. Nothing. Like that's what it could look like. That's that's one side of the spectrum. On another side of the spectrum, it could really look like you going in for a little bit of understanding of your medical condition and some blood work, and being told like the same sort of advice that, okay, the only thing we can do right now is work on weight, and then we'll get to the other stuff later. It can look like a lot of different things. I'm sure there's better examples. I'm so not good at like thinking of examples on the spot.
But can I ask something? Something though? Like, so with PCOS, like I never experienced, so I'm someone that's learning about it through guests on and yourself. So with PCOS, like if I showed up and I, want to work on these, potentially being diagnosed, or there's like, the fact that I'm showing up in pain, going through things, and my doctor's saying, whoa, Kieran, let's first start with like your weight struggle. Like this will help you with all the other things. And you're lazy. Let's say my doctor's like, you got to move more. Like you're not moving enough. So is it possible like a symptom would be, would be able to combat my laziness? My symptom of why I'm not moving more is I'm fatigued, I'm tired. Could I, low mood, depression, all these other underlying causes could be the reason why I'm quote unquote lazy?
Yeah, well, like fatness has nothing to do with laziness, first and foremost, right? Like, again, bodies are the way they are for many, many, many different reasons, and we all carry fat differently. A lot of it genetic and hormonal, even are the hormones. So going back to PCOS, for example, there are certain genes that predispose us to like misfiring of signals for satiety and hunger and insulin resistance and how our body deposits fat, right? Like there's so many different things there. But to answer your question, yeah, like there's obviously things that we can do that are not weight related that will help you feel better. And when you feel better, you're more apt to do things that will be more health promoting as well, right?
But like why can't we start with that though? Like if I'm sitting and you're right, like, I'm not mad at all the doctors and stuff, but I'm just saying like, if I'm showing up and quote unquote, I need to move more because I'm not and I'm lazy, however we want to put it, but I can't because there are things that are getting in the way of me doing that. How is it that we're not, they tell us to be curious, they tell us to dig deep, they tell us to do all this stuff. So how is it we don't go to the next question, which is like, what could be the underlying factors of why I am lazy? Because then if we address those, then maybe I would not be lazy and move more, but we're just stopping at the fact that it's a me problem. Like that's how it feels. I'm in your doctor's office and now it's a me problem. And I already know I'm a problem, like, because I'm sure I'm feeling like crap. So I just want to break that down for anyone listening, because I feel like that's like a common battle back and forth of, someone telling you just to do this one task, which is one way, but we don't look at the iceberg. If you look at an iceberg, there's more going on underneath, and we're not looking at that.
Yeah, and it's a good question. It's a complex answer. And again, I don't want to brush all doctors with the same paintbrush, right?
Yes.
Like everyone's going to be a little bit different. And going back to our broken healthcare system, I think part of it is time. There's a high degree of physician burnout right now, very understandably, right? Like where our healthcare system is underfunded. So that's part of it, right? Like the lack of time. And then also, I think part of it is also a training problem, right? Like, so last year in 2023, we got some beautiful PCOS guidelines. Again, like I keep going back to that topic because like it's near and dear to my heart and what I encounter on a regular basis. But we got some good guidelines that said that sort of, named weight stigma in medical care, and patients are feeling this because they had patients as part of those, as consultants for those international guidelines, and medical care professionals and other industry stakeholders. So weight stigma was listed, right? And then we also had more guidelines around like, even if someone's weight doesn't change, there is benefit to lifestyle modification. Lifestyle modification for PCOS should always be part of the picture. However, family doctors, for example, aren't super well equipped to guide patients with lifestyle modification. B, lifestyle modification is timely, and patient visits, like doctor patient visits, are short. We can't really do that. So I think like systemically and structurally, we need better resources to give to patients. And I think like that's also why like I have the luxury of time with patients, like more than a family doctor. The patient's health would still happen mostly outside of my office, right? Like, however, I'm like sending them with tools and trying to really have conversations with them. And family doctors don't unfortunately have the time to do that, right? So it's not just the person who is the doctor; it's also like the systems that they're working within. I think like it's all of it, unfortunately.
Totally. But here's what's happening is that we are going from not a preventative, but from like a reactive approach. And so then we're not really looking at longevity or health, like the quality of life. And so even if you look at the, elderly, like retirement, all these kinds of things, we kind of, this is your cutoff and you're done. But that's such a burden on the health system. So we're working harder than smarter because we're all coming back through the revolving door, whether it's mental health or our physical health. And then, it's like, we do have to, with these conversations, wherever we can, start small, but start somewhere because the systems won't change. Then you got consumerism. So you have that on top of it, right? Like, let's just get, everyone's getting paid up top while your patient in the office and all of us are not getting that. So I just think also we do have to, and I don't have the answer, but I do think we have to keep pushing, whether it's advocating for ourselves or something where, as individuals, we look at our own health in a way of like, what is my history? How did I get to this place? Someone thinks I'm fat. Someone's saying I'm obese. Someone is saying I need to lose weight. Okay, but how did I get, or someone saying I'm depressed. How did I get here? Do I think I am?
Yeah. And yeah, it's hard, like, right? Like, and I'm just going to call it out as what it is. Like, it's hard navigating your health.
Yeah.
It's hard navigating healthcare is hard. I really encourage anyone listening or watching to really track things down, because ultimately, like, you can start to pay attention to trends that you're noticing in yourself, what helps, what doesn't help, or when do you remember the first incidence of something was, or, you know what I mean? Like, any changes that you've implemented or tried. And when you're with your doctor's office and they're just focusing on weight, let's say, then that's a good point for you to interject and be like, hey, I'm not here to talk about my weight. My energy is really the thing that's getting in the way of my life to like cook food for myself, or just like, do my daily basic tasks and get to work or school or whatever it is.
Right. Yeah.
I think like the onus, unfortunately, still right now is on us to step in and be like, hey, I'm going to redirect you to what I really want to talk about, which is X, Y, Z. I hear you. I understand you. Or just shut it down. If you want to shut it down, that's fine too, right? Like, ultimately, like, I think there is still that power dynamic in a medical doctor's office or just any doctor's office where we feel uncomfortable. And it is uncomfortable to call people out, right? The confrontation, like, I don't like it.
Like, a doctor is like your lifesaver, right? Like, authority. And so it's like a cop. Like, I'm scared of you. I can't, but you're right. We can't pass the buck. Can't say, well, it's the doctor's responsibility. And the doctor saying it's mine. Like, we all do have to start with ourselves. As a doctor, I appreciate what you're doing, where you're looking into your own biases, changing parts of your own practice. And as an individual over here, you're right. Like, that's my role to walk in and if I want to get something different, then I also have to be willing to do something different. In order to get that, which might be speaking up to my doctor when I'm in the office. Is there anything else you want to add to this before I go to the next? I wanted to ask you another question.
I actually would just want to say, or take someone with you, right? Like, if that helps you receive the care that you need. Sometimes I will ask patients to take someone that they trust and who cares for them with them, and that can change the dynamic. And actually, in one of the books that I'm going to mention, one of the strategies, especially for fat people, where the doctor is only focusing on weight loss and nothing else, taking someone with you can be a great way, because then the doctors like check what they're saying, right? Like, it keeps them in check.
I like that strategy. That's a really good one. As we're talking about strategies, maybe we should look at some more tools and tricks. What are some things that you would suggest for, you are sort of doing this along the way. Anything else that stands out for you or that you learned that you think could be really helpful as a tool when we're addressing weight stigma?
Yeah, there's so much to say here, but I'll share my resources here, I think, because I think there's a great benefit to hearing from people who do this work for a living, right? Like who live in this world and explore it so much better than I have so far. So one is, I just have them here, so I'm going to read them. Fearing the Black Body, The Racial Origins of Fat Phobia by Sabrina String. That's a book. Second one is Belly of the Beast, The Politics of Anti-Fatness as Anti-Blackness by Deshaun L. Harrison. Because as you were saying at the beginning, right, like there's lots of conflation of weight stigma and racism, like they are intertwined. And then Aubrey Gordon, who goes by Your Fat Friend online, her most recent book is You Just Need to Lose Weight and 19 Other Myths About Fat People. That's the one I've been reading recently. And I really like it because it has reflection questions and little pointers to like what you can say if someone says X, Y, Z. I really like it. And then she also has a podcast called Maintenance Phase, which I really, really love because it's like very like sarcastic humor. She does it with another person. If someone's looking for that. And I think like part of it is to have these conversations in our like more openly with our loved ones, right? Like in different areas and explore that. Like I said at the beginning or somewhere today, or maybe we were talking about it earlier, like because this is in the fabric of the world that we've grown up in, like it takes effort and actual time for us to actually unpack it and really unlearn it, right? Like and move toward something different, something better, something more inclusive for everybody. Because we don't treat like underweight, like if we're looking at that BMI chart, being underweight is also associated with great health risk, but we don't look at those people in the same light as we do people on the opposite spectrum of the BMI, right? Like there's so much to unpack there and go through and really reflect on. And this is going to be a lifelong journey, right? Like I know it is going to be for me, because as with anything, the more we learn, the more our understanding should change and should become more nuanced, right? Like that's what I think. Like, yeah. Right. Like as I do conferences and as I learn more, my practice changes. And if it didn't, that would be a bad thing, right? Like it should be changing.
Yeah, right. Like, absolutely. Why do you think the medical field has historically focused so much on weight as the health indicator? Like, why? I know we talked about some context, but why do you think that was the one? And we're still attached to it.
Oh, gosh. Again, one of those people who wrote those books can explain this a lot better. I think it's like multifaceted, right? Like I think it is rooted in racism. I think it is rooted in, right, like the obesity epidemic. We've sort of latched onto this one thing that is very like physical, right? Like I think it also has to do with beauty, quote unquote, ideals. And classism, right? Like I think it has a lot to do with all of those things at the end of the day. And I think we need to just change direction. Right? Like we've gone down this path for a long time. I think it is totally fine to turn back.
Yeah. I agree. I think it is definitely time. And I think the younger generation, they're figuring some things out. If even you had addressed a little bit of in the beginning, we have so many different ways of even identifying in the way we look at gender roles. And when you sometimes have a conversation, should anyone with the younger generation, there's a lot more of fluidity. There's a lot more openness around less about the way we're looking and more about, differences they want to make. And it's an interesting change I've been seeing with the younger generation. And I think, hey, kudos to them, because they're trying to flip the script. And to be honest, there are so many of us and generations before us, and maybe it's the women, but I'm sure there are so many others in between that would say, nope, for me too, where it's so deeply ingrained in you that it becomes so hard and almost impossible to undo. And then, you start to think about, well, should we just focus on the younger generation because we can do proactive preventative work with them? However, we kind of need us to also, role model, influence, push things in the way. And so I think that there's never a bad time, whatever era we're in, to go back and look at these things that society has decided, whether it's weight stigma, like you said, ageism, racism, all those isms that keep getting in the way and take up a lot of space up here, to look a certain way. And my husband and I were talking about this, with even just working out. You look at a body and you just think that body is so fit and that body's not. And the body is just more than that. It's our vessel. It's carrying us in all sorts of ways, carrying our history. Some of our bodies need a little more space to carry some of our history. So it's very interesting when we look at it just from the outside of, is that health? Is that not health?
I think that's how a lot of us got to this point too, right? Like it's really just not thinking about it because it's sort of ubiquitous and it's taken at face value. And I had another thought as you were speaking, which was there's like this morality associated with not being fat, because like it also means that you have the discipline to keep your body in shape.
Oh, yes.
Right?
Productive. Yeah, you know what? Let me tell you something. This is so effed up. You want to talk about being productive and fit? Like, imagine how messed up I would have to be when I was working crazy 24/7 and, our kids were young. Like, I was being commended for getting up at 4:30 every morning to go get my workout in, because I do need to work out for not just physical, my mental health. And so I would have to do this, but a lot of it obviously was to look good. So I'm getting up at 4:30 every morning to go do this, to be back and showered and ready. And I, put in a lot of effort to get ready. So it's not even like I didn't, so I used up all this time to do this. So then I could tend to my kids, get them to school, whatever we needed to do, and go and do my 70 hours of work. And you think about these things, that how do you not look at it from a way of like, that's fucked up, because you're taught that's amazing. Good for you for putting the alarm on and getting up at 4:30, Kieran. You must be, a leader. Like that is how I was often looked at, as this like people would also start to do that. People were influenced by it that I worked around. They're like, oh, I'm going to start doing that too.
Yeah, and the comments and compliments on body and even weight loss, right? Like some people lose weight because they're significantly ill or having a hard time in life, and we compliment that knowing nothing about them.
Yeah, you look so good. What are you doing? Or always like, I'm on a diet. That was always the way to show that you were disciplined in an office meeting, of like, no, I'm on a diet. And then everyone else feels guilty because you're on a diet and everyone else is eating 6 pieces of cake. And so then we do one extreme to the other, right? But like you said, we only look at the one, which is the overeating, the thing that's contributing to me getting bigger, versus the thing that we're doing to not, like, it's like you said earlier, it's not any better being underweight. Yet we don't necessarily, shine a light on that until it's an immediate health risk.
Yeah. And being underweight, like that comes with its own challenges. Like as someone who used to be pretty underweight and had a lot of unsolicited comments coming toward me, and knowing a lot of people and having patients in practice who are on the opposite end of the spectrum, like ultimately, I think what we need to move toward is really not commenting on people's bodies, because you never know what they're going through or what is going on. Let's focus on other great aspects about them, right? Like their personality or whatever, depending on the closeness of your relationship, right? Like we're not going and commenting on things of people we don't know, but like there's a context and there's a time and a place for everything really. But it's so interesting that, and I think and I think that is part of like this whole conversation, right? Like because we see the physical body, like we tend to comment on it the most, and we tend to then care about it the most as well, because that is how we're presenting to other people.
And yet there's more than meets the eye. So it's like, how do we rate? The Transformers, so wise. They always knew when they would say that. And here we are saying it now. There's so much more there. And, I am grateful to be and the time where we can sit and have this conversation and recognize this. You know, when you think about the times that women weren't, or people that were tending to their weight, and the way that it was, you know, massively supported, I think, okay, there has been some shifts, but definitely we have a ways to go. So are there anything that comes to you or comes to mind that you think professionals can be doing, educators can be doing, people that have a little more influence out there could be doing to shift that conversation with weight stigma?
Yeah, I think we all can be doing something, right? Like, and this is why we're having this conversation where we're unpacking some of our own stuff as we talk.
Right. Parallel
and learning
process.
and unlearning and relearning at the same time. I do think like those resources are a great place to start, because like it will sort of get the gears turning in your own mind. Definitely reflecting on your own relationship, seeking out professional care if you are someone struggling with that, right? Like safe spaces to talk about these things. Sometimes we just don't talk about them, and then they keep hidden, you know, obviously more than most, like the impacts that can have of like not speaking and keeping things in, because ultimately like we live in these bodies our whole lives. We have to eat food and connect with other people, and also you know, live in this world. So like I think it's a service to all of us if we start to unpack this in one way or another. And it doesn't have to be perfect. Like this was an imperfect conversation, and we'll likely have more imperfect conversations about this. My patients correct me sometimes, and that's okay. I encourage it, right? Like I try to create a safe space for them so they can do that. And that's how we learn. If you're noticing someone saying something that is, you know, hurtful or unkind, or this negative connotation associated with weight, speak up, right? Like it doesn't have to be harsh. Like you can do it in your own way, right? Like my way is like gentle. If your way is direct, you do you.
Well, I'm not direct. What do you mean? Yeah, no, but you're totally right. Like I think that's the thing is, I really like what you're saying, because sometimes when we are trying to make a change, or we notice we want to try something different because we've learned something, we have a hard time because, like you said, we want to perfect it. We want to be so good at it. But I think it's also recognizing like that's just our ego. This is new to all of us. So we're going to fuck it up. We're going to offend someone. We're going to get offended. But then like, can we just go back to it quick? And then come back to it, right? Because like when we leave it alone, then we stop talking to people, then we stop going there and having those kinds of conversations. And at the end of the day, it's just us learning. Like you said, it is a parallel process, and we can't really, you know, do any of this if there's no compassion. Like if we look at the context, this has been here since the beginning of many of our time. And so in order to unlearn it, it's going to be many, many a time potentially to get there. So if someone is just starting to unlearn, let's say like weight stigma, like what's the first step you would recommend they could take or focus on? Because again, sometimes we want to know the whole thing and just be so good at it. But what is like one thing we could just sort of chip away at or think about or focus on?
What does the word like fat bring up for you? What does when you look at your body, like what are the things that you notice first? Or if you're looking at someone else, what are the things that you notice first, whether it's in a negative light, neutral light, or a positive light? And yeah, like look toward people who do this work, because I think they are probably the best people to learn from. And even like going out in the world, like once I started entering this world of really acknowledging, I'm like, oh my gosh, I had some of these like assumptions about fat people, that it was their choice, right? Like, and that's a really uncomfortable and disgusting feeling now. But at the same time, like that's where I came from, right? Like, and I have to acknowledge that in order to move forward. So if you feel icky, you're definitely not alone, but we have to get past that and continue to learn to be not on the other side of it, but sort of like continuing to learn it, and that might come up again, right? Like, and that's what we say about thoughts and feelings, like it might come up again, but we become better at getting past like that ego part of it and just moving on to the other side of it. And I think that's all we can do. I don't know if you, as we've been chatting, if you have any thoughts on what a first step might be.
I love what you said. I think this is it. I think acknowledging that little tiny feeling inside of you when it goes off, when someone says something, and you mentioned the isms, racism, sexism, when someone says something that doesn't sit well with you, I think that's a sign. And so when that connects to weight, I think that's a sign of, oh, this isn't right, or there's more to this. And, at the end of the day, like the big piece is we worry about what others will say and do. And it's really not going to help change or flip the script if we continue operating that way. Like, we got to start with, okay, what does this mean to me? Weight is an issue for me. So how do I tackle that before I start, influencing everyone else around me? Like, that comes naturally. I think we just have to go to that place of what is my relationship with weight? Maybe that's the thing. And I think we'd go from there. I know where mine is. Mine's a roller coaster. But now I'm at a place where I'm okay talking about it. I can share it. I'll wear the tops and the pants and the stuff of like, this is me. This is who I am. This is all of me. But that's also, my own battle. That's, also recognizing that we're not projecting it onto others. And I think if we just like own our stuff that way and be okay with it, be okay with having those conversations. I had a conversation with a loved one recently who we're in a similar boat, and they're anxious about shopping, and their body is going through changes. They're going through menopausal stuff, and they had gained weight, and some of that had to do with medicine. And then, they're going through now the extreme of losing a significant amount of weight. So there's trying to fit into fat clothes and then trying to fit into skinny clothes. And so anyways, they're just learning how to rewear clothes in their body. And the fat shaming kind of starts in those conversations. And you don't even realize it, right? Because you're like, oh, this isn't made for me. It's not my body type. You can pull it off better. And so we're trying to make a pact about kind of bringing that up to each other. We're close. We have the trust to be able to say, there it is. There's the stigma. And so, in the moment now we have to do something nice for ourselves or say something nice. Because, the brain, mind, and, all that doesn't forget that kind of negative self-talk. We start feeling it, believing it, and, we are. And
yeah.
So
mine's funny.
Yeah.
Yeah. My automatic is like, I'm grateful for what my body can do for me. Like, that's like my way to like come out of it, because again, like, I'm also human. I have thoughts, and I've lived in this body for almost 40 years now. You know what I mean? Like, there's things that are go-tos, and you might need like a little something that gets you out of that state to sort of just be like, okay, what am I saying, or what am I thinking, and how can I navigate that? Some days it's easy, some days it's not easy, right? And one of the things I'll quote ish from Aubrey Gordon, because it's I just listened to it like a few nights ago. Instead of saying things like I feel fat, which is like, again, coming from like that negative connotation of fat and fat people, just name what you're actually feeling. Like, I feel bloated. I'm having a bad body image day, right? Like, and I really appreciated that, because that's something that I've heard for so long now. And I didn't have good language to be like, okay, how can we change that? And I'm like, okay, this is a good way of changing it, because like, that just perpetuates the weight stigma conversation we've just had, right? So totally. I always moved, like my strategy always is to move into gratitude anytime I'm feeling, right? Like, yes, I feel crappy and I'm grateful for, right? Like, it's the and, not the but.
And that's good.
Yeah.
Right? Like recognizing the and. I love that you said that, because it's like where you are at. And I think the other part to what you're saying too is like negative self-talk versus positive self-talk. So how do we flip that script? How do we switch that? But before we can do that, how do we recognize, oh, here I am in this place. I'm trying to meet someone else's standard of what my body's supposed to look like. And I think that's a lot of what we're learning in this is someone decided we have to look this way. And who decided that? why did they decide that? Because I don't want to be part of that, right? Like just even menopause, even all these sorts of stereotypes, someone decided that this is the way it is and we're going along with it, and it doesn't have to be. Giving birth is another one. Someone decides this is the way it's going to go, and again, that's not necessarily the way it is. So I think the and is huge of I'm not one or the other. It's how do I balance that? Somebody, like you talk to elders, I think they're another example as we talk about strategies. Like our mothers, our grandmothers, our aunts, like they are such good role models, especially in the South Asian community when they show up wearing saris and lengas and our beautiful outfits. And a lot of times, like I won't wear those outfits because I'm like, my body's going to show. But I think when we see the story and our aunts, our grandmas, our mothers, our sisters and all that, we realize like we each we're wearing our stories in such a different way, and yet we're connected through blood or family or community. And I think sometimes it's like nice to see elders and people that we can look up to in that way of like, yes, okay, fine, they can body shame us because they don't know better, but then at the same time, they also will show up, owning with what they have or where they're at or whatnot. So it's like they look good. Maybe we'll edit
the juxtaposition of like their body shaming us. I know. Super comfortable in their
wait
own
a minute. Yeah, no, I'll just stop there because hold on a second. Maybe that's not where I was going with that, because I just thought sometimes they will say to us, right, when you get married too.
No, but I think you bring up a good point in the sense that like I think there is like that juxtaposition that they're comfortable wearing whatever, and then they're also like body shaming us a little bit because we're younger. Because like I think
sometimes
like,
they're slut shaming us though. It's less body, it's more that, true. Which it's like, hold on, right?
that too. But I think like bringing it back to our conversation, like bodies change, right? Like that's kind of like my go-to. I'm like, bodies change, yes. And they're supposed to.
Yes, they are, aren't they? Because otherwise I'd still look the same as when I was 5 and 6 and 8 and 10 and 13 and 20. Like there's a reason why they're changing, and they're elastic, I guess. They're bendy and they move and they do those things. But just to go back to your gratitude piece, I think that's a big piece about, I have a aunt, as we talk about elders, she's 70, and you would not guess this. And one thing that she does every day, after her shower, is that when she's maybe lotioning or whatever, oiling, lotioning, whatever your body, if you do that, from the bottom to the top, thankful for every part, your feet, your legs, maybe your knees, just again, reminders of being present, grounding in the moment about what they were actually meant for. My body was meant to get me from this place to this place or do this. It wasn't meant to, pose in sexy photos, which is a bonus if I can do that and want to do that, great. And I just really had a visit with her recently, and I really appreciate that stuck with me. And so I've started to just do that, just to be in the moment, because we use all these parts for other things, not so my shirt will look good on me. So I think, that's what I was trying to go with the elder, and I got caught up with the sometimes they also body shame us, but just like you said, the presence, like when you were talking about being, grateful, like of being okay with where we're at right now, and that's okay.
Yeah, I'm thankful for what my body is able to do for me and what it allows me to do in life, right? Like I get to cuddle with my dogs and kiss my husband and, spend time with my family and cook with my mom, or mostly just like eat her food. But
yeah,
but you know what
100%.
Yeah, and the work that I do, you know what I mean? Like, so I think it doesn't have to be positive if someone's not at that point, but it could be neutral, right? Like we could start from neutrality.
Yeah. Right. Exactly. Because sometimes hearing these positive things, it's like we're not there. Not everyone's in that place. Like you and I are talking from a place of recognizing, having done some work and getting together and having this conversation. But for some, it's just even learning about waist stigma. Everyone's in a different part. And I think that's okay, as you're saying. It's the fact that we're trying to learn and we're trying to grow and go at our pace. Bottom line is weight is not the be all end all to our health. There are many other factors in between and around. And while weight might be one way to look at something, we also have to look at lots of other parts. And a big part of that is knowing our story, knowing our history, why we are the way we are and how we came to be. I think that might even help approaching some of the stigma, on ourselves with how we're supposed to look and whatnot. So anything you want to add to that, or anything that you wish we did talk about with weight stigma today, Dr. Hussain, that, we didn't get a chance to bring up?
I think we went all sorts of places, which I really loved and appreciated. No, I liked how you ended things. Your health is not just about your weight. Weight can be a factor, but it's only one factor. There's way more other factors, right? Like, so focus on, my focus always in practice is to focus on the health promoting habits, eating the fiber, moving the body, working on stress management, making the connections with other people, and engaging in things that you like doing and enjoy doing. And sometimes, not to say like any of that is easy, sometimes it can be really hard, and you likely will need some help with that. But even in your medical care, getting a team, if you're able to, is going to be the best way forward, because like we mentioned, medical doctors only have so much time. And then, you'll have to advocate for yourself a little bit or a lot.
Yeah, for sure. And that can start at any point. It doesn't have to be at a doctor's office. That could be in our own minds. That could be conversation with ourselves about, I'm worth this, moment of taking care of myself. I'm worth fighting for. I'm worth looking at some other underlying things. I'm also worth being okay with where I'm at. And, at the end of the day, that's where we got to be. We got to figure out where we're at to get to where we want to. We do like to say these conversations are door openers, and we're opening a door today talking about the stigma of weight and how that can impact us. And we'd love more people to join us. So reach out to us. We've shared where you can find Dr. Hussain. We'll have her socials in our show notes. But also reach out to us and let us know how you want to be part of this conversation, ways that you are working on weight stigma. There's probably lots of things that we both didn't cover that you can contribute to, so we can keep this conversation going. And that's what we want to do. Anything you want to add, Dr. Hussain?
No, but I would love, if you hear back from other people, I would love to hear what people have to say, because I want to learn too.
Yes. Okay. We will make sure. And so, 2 times is fun, but I hear 3 times the charm. So maybe we can get you back soon again for another talk.
Anytime.
We love it. We love having you. Thank you so much for being here. All right.
Thank you.
Ba 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 ba.